How Republicans and Democrats are working on a bipartisan health package. Republicans are working on a bipartisan healthcare package to lower drug and insurance costs, a move that has sparked debate among Democrats who remain skeptical about GOP collaboration. Senator Bill Cassidy, R.La., is leading the discussions, focusing on transparency from pharmacy benefit managers, PBMs, and addressing practices like upcoding and Medicare Advantage plans. A group of Republican senators, including Alaska's Lisa Murkowitz, is pushing to extend expired health insurance subsidies for individuals purchasing coverage through marketplaces. However, Republicans are cautious about the package, which is still in its early stages, as noted by Senator Michael D. Crapo, our Idaho, chair of the Senate Finance Committee. "We're aiming for bipartisan legislation that could stay in place," Crapo said, emphasizing that other initiatives are also under consideration. The reconciliation bill, which cuts billions from Medicaid and complicates healthcare subsidy eligibility, has left Democrats frustrated. They claim to want to work together, but they've already published a front-page story about Republicans' interest in another bill, said Senator Ron Wyden Dior, highlighting the tension. Democrats, however, see an opportunity to expand healthcare subsidies, which expire at year's end if Congress doesn't act. Initially expanded in 2021, these subsidies now benefit low and middle income individuals. "I'm part of a small group trying to find a path forward," Murkowitz said, noting Cassidy's leadership. "Our failure to address this could lead to soaring healthcare costs for Americans. There's been some progress, but this is just one part of the broader conversation." Meanwhile, Republicans appear less urgent in addressing the issue, as insurers already demand double-digit premium increases for next year, citing subsidy expiration and drug tariffs. The Congressional Budget Office estimates a $335 billion cost for a permanent subsidy extension over 10 years. Other proposals include a Cassidy-led bill targeting upcoding in Medicare Advantage plans, where insurers allegedly inflate patient diagnoses to secure higher payments. Senator Jeff Merkley, Dior, co-sponsors the bill, calling it beneficial for patients and the system. "It's good for everyone," Cassidy said, though he was hesitant about a larger package. "We don't have a hearing yet. People are speculating we might pass a healthcare bill. It's way too early to discuss anything." Crapo expressed disappointment that the upcoding provision didn't make it into the reconciliation bill, but acknowledged uncertainty about its inclusion in future bills. In the Senate Finance Committee, PBM-related bills are gaining traction, with both parties arguing PBMs drive up drug costs by negotiating prices between health plans and pharmaceutical companies. The Senate's reconciliation bill included language eliminating spread pricing in Medicaid, where PBMs charge more than they reimburse pharmacies. The House version would require greater transparency from PBMs. Senator Charles E. Grassley, our Iowa, highlighted the urgency. "We need a PBM bill by year's end." Congress also faces other expiring health policies, including funding for community health centers and Medicare telehealth coverage, as fiscal year 2025 approaches.